This is the healthcare delivery providers as part of the Healthcare Marketplace Specialization. This is Module 1.1.1 Course Overview. Hello, I am Rahul Korane. I will be your faculty for this course, which looks at the healthcare delivery providers and the healthcare system in the United States. And I want to begin with a little simulation for you. So let's think about the delivery system like this. So here is the delivery system. Maybe this is the hospital. Maybe this is the primary care clinic. Maybe this is a specialty clinic. Maybe this is some other services that is provided in the community, like home health care, where a nurse sees a patient at their home. Maybe this is some other services in the community, for example, a gym or a pharmacy. So what do we need to look at when we need to dissect this healthcare delivery system? And what we will do in this course is we will look at each component separately. So what's the primary care clinic? What is it made of? What is it like? What are the components? What is the organization? Specialty clinics. What is the organization? What is the leadership like? What are the quality metrics? Same thing with the hospital. What does a hospital feel like? What is the leadership like? The structure, the metrics, the money flow. Same thing with the community-based services and other services in the community. So this is the healthcare delivery value chain, for example. Now, obviously, we need to look at the patient. So here's the patient. And the other component, which is as important sometimes as the patient, is the family member. So here's the family member of the patient as well. So we will be utilizing a case study, which I hope you have already read. If not, I encourage you to do that right now. And then this is not the only thing we will look at when we think about the healthcare delivery system in the US. There are other stakeholders. So at the bottom here is the community, the context of the delivery system. Here's the payer. Might be a governmental payer, might be a commercial insurance payer that pays for the delivery system. And then there are many other stakeholders that we will be considering as well. So maybe there's other governmental agencies, maybe there's regulatory bodies, maybe there are advocacy groups or non-governmental organizations. So again, just a quick context as to how we will be looking at the delivery system, which is in red. So we will be dissecting all the components one by one in each of the modules, and I'll talk about that in just a second. And then we will look at all the other stakeholders so that we can get a good view of the healthcare delivery system and all the various stakeholders and forces that are shaping it and transforming it. So with that, let's get started. So typically at the beginning of each of the lectures, I will have this slide which lays out the learning outcomes or the objectives for that particular lesson. So for example, for this lecture 1.1.1, the learning outcomes are that we will understand the flow of the entire course and also understand the content in the various modules. And on the right here, you will become familiar with this particular icon. This is supposed to be me. As you know, I am a physician, and this particular icon will show up throughout the course in different modules, in different lectures, in different quizzes, so as to point you to some of the important key learnings I want you to remember. So here's the familiar icon again. And this is a slide I will use quite a bit throughout the modules when I want you to focus and learn some acronyms that I will be using in that particular module. So for example, I want you to remember CMS, or the Centers for Medicare and Medicaid Services, which is the largest governmental payer in the United States. So again, CMS, Centers for Medicare and Medicaid Services, and I will use this slide in the modules to draw your attention to the acronyms that I want you to remember. This slide depicts the centrality of the patient in this particular course and all of the modules. So as I just discussed using the simulation, we will look at the healthcare delivery system in the United States by following the patient's journey through the healthcare delivery system, which will make it easy for all of us to understand. So here is the central character in our case study. So I hope you have all looked at and reviewed the case study and addendum. So this is Mr. Harlan Reeves. This is his wife. And as you have seen in the case study, he travels through the healthcare delivery system, and we will use his journey as a way to identify and then dissect the various healthcare delivery system components and the various providers of healthcare delivery in the United States. So again, this course is going to be extremely patient-centered, and we will use the context of the patient's journey through the healthcare delivery system as a way to dissect the various components. And as I indicated with my simulation, we will be looking at the delivery system using multiple lenses. So here's a couple of lenses or dimensions that I want you to think about. So maybe the first one is the delivery system itself and the various providers like the hospitals, the clinics, the home care agencies. Another dimension might be the money flow, so the dollars or the money that is being paid and the payers for the delivery system. Another dimension might be the workers in the delivery system, and this could be the physicians, the nurses, the social workers, other volunteers and staff. Another component might be the role of the government, and sometimes it is the payer, sometimes there are other forces at play when the government works with the healthcare delivery system and helps shape it, also drive innovation in it. There are other lenses such as the social service organizations and non-governmental organizations in the clinic. And then finally, the most important component and the lens is the community or the patients themselves. So that's another critical lens that we will be looking at when we think about the delivery system. So again, multiple dimensions, multiple lenses. We will analyze the providers one by one using these various lenses. Again, this is the familiar icon I will be using, and usually there will be a quiz in the middle of each of the lectures, and so at this time, let's take a very short quiz. We will talk about this particular delivery roadmap in more detail in the upcoming lectures, but I wanted to give you a quick visual, again, a schematic of how the healthcare delivery system is laid out, like I showed you in the simulation. So here's Harlan Reeves right here. And this is his journey. And again, I'll go into more detail in just a few lectures here. But this is the journey as he flows through the delivery system in the US. On the vertical axis are these various components that we will look at. And again, as I discussed, these are the sites of delivery or the care journey of the patient and also the family throughout the healthcare delivery providers, and we will use that case study and this particular delivery roadmap, which you will see over and over, and I really want you to remember this by the time you finish this particular course and the various components. So this will be pretty key as we follow the journey of the patient and dissect the various components. Here's how I have laid out the modules in this particular course. So right now we are in module number 1. That's going to deal with the introduction and the context setting for the US healthcare delivery system. The next module will focus on hospitals, various types of hospitals, large and small, community and specialty. The third module will look at post-acute. These are services that come after the acute care hospitals and other community-based services. These are services in the community, social services, and other services. Then we will look at, in Module 4, clinics, primary care, specialty clinics, and then this very important concept that is emerging of population health. And finally, in the last module, I will cover some of the innovations that are happening that are helping transform the delivery system in the US and shaping it to become the healthcare delivery system of tomorrow, to make sure it is sustainable and also it continues to create value for all of the stakeholders. Right off the bat, at the beginning of this module and this course, I want to make sure that all of you are aware that most of my practice, my leadership, and my journey has been in the state of Minnesota. So Minnesota is one of the 50 states in the United States. It is consistently considered one of the leaders in healthcare across the United States. And so a lot of the models that we will be talking about that are in Minnesota have actually created standards across the US. But I want you to understand that a lot of the context, a lot of the examples, a lot of the components of the delivery system that I will be talking about will be from Minnesota as one of the states in the United States. And a lot of that is transferable to the rest of the US. Some of it may not be, but I think most of it will really be easy for you to understand as we look at the healthcare delivery system. Finally, at each of the lecture end, I will have this slide which covers the summary. So at the beginning, I will have the objectives, and at the end, I will have the summary with my friendly icon being me. And so for this particular lecture, we looked at how this particular course will keep the patient journey through the healthcare delivery system at the very forefront. So remember Harlan Reeves. I want you to look at the case study and the addendum now and review it before we go on to the next lecture and the next modules, which will make it very easy for you to understand. And the next summary point is that the 5 modules will look at the various different components and sections of the healthcare delivery system one by one. So with that, we'll end this particular lecture, and the next thing to do is to look at the case study and addendum, review it, and then we will go on to the next lecture.